Well, the emergency room is an obvious answer for someone experiencing a life-threatening injury or other health complication. But the ER can also be a place to turn when mental health concerns become an emergency. And today's Mental Wellness Wednesday, when it may be time to turn to emergency care.
We see a variety of mental health issues. Sometimes it can be interspersed with other medical issues or physical issues as well.
Dr. Joe Lever with Mercy One has worked in the emergency room for 23 years.
Mental health issues are very common, whether it be depression or anxiety.
He often treats people in the ER who are experiencing a mental health crisis.
The thoughts of wanting to harm themselves, whether it's depression or other mental health issues leading to a psychosis or substance abuse issue, where a patient is having a thought of wanting to harm themselves or harming others. That's truly an emergency that we evaluate here in the emergency department.
Healthcare professionals treat mental health concerns just like any other ailment they see in the ER.
We see patients that come in with physical symptoms, and we do tests and we rule out issues, and we may admit patients to the hospital for those physical conditions. It's the same way with mental health issues. We evaluate patients. We help, try to see if someone is a threat to themselves or others that could be helped, whether it be with hospitalization or follow-up care.
If someone is already being treated by a psychiatrist or other mental health professional, they can often reach out to their own doctor during emergencies. But ER visits are oftentimes the first step to beginning mental health care for someone in crisis.
We see a lot of folks that come in for evaluations either on their own or with police or with family. You know, if family members are concerned about another person in their family or a friend that has, that they think might be having those issues, then they should seek help.
Now, Dr. Lever says the ER has seen a steady increase in visits in recent years. That includes mental health evaluations. They've also seen a big increase in substance abuse, which often involves connections to mental health care in the future.